and welcome everyone to the third COVID-19 Robots and Us weekly discussion with experts. We're going to have a very interesting discussion this week as we look at some of the less well-known ways in which robots are assisting people during this crisis. If you remember from last week when we had Robin Murphy, who's really the world's leading expert in the field of disaster robotics, she showed us a taxonomy of the ways in which robots are responding to the COVID crisis. And she showcased at least 18, I think, different areas in which robotics is helping right now. And many of them were not areas that we traditionally think of. So this week we're going to dive in a little deeper into that. And we're going to be talking about, well, I won't give away too much. And we're also going to be talking about what you can do in the local area as well. So you can almost see the video from last week's great discussion on the Silicon Valley Robotics YouTube. Hopefully by tomorrow morning, it's going to be finished and it will be up because it certainly was a great discussion. And I'm looking forward to another really good discussion tonight. And just for housekeeping, if you're not a speaker, please keep your video off and your mic on mute. If you've got a question for our experts, please put it into the chat. We'll be monitoring that and doing Q&A after the introductions. And now let me introduce our guest speakers for tonight. Firstly, we're going to hear from Linda Pouliot, who is the founder and CEO of Dishcraft.
Hi, nice to meet you.
Hey, Linda. Now, could you please tell us a little bit about who you are, what your background experience is, and a little bit about Dishcraft?
Oh, sure. So I'm the CEO of Dishcraft, and this is my fourth startup. The second one, which is Robotic. My first one was the number 2 player in automated vacuuming. It was called Nido Robotics. And now I'm on to Dishcraft, which is cleaning dishes. So Dishcraft is a startup that we're automating all the tasks in a commercial dish room using robotics and process innovation. We're solving sustainability and labor challenges. And we have a product called Dishcraft Daily, where every day we deliver clean dishes to cafeterias, like a linen service. And then we bring them back to a centralized dishwashing hub where our robots wash them.
Which is pretty cool. So it's not the sort of robot dishwasher that we're going to expect in the consumer house anytime soon, is it? In fact,
no, I mean, my husband always jokes that he's like, hey, where's the robotic dishwasher here? Because the dishes are piling up.
Yes, but you had to tell us why you picked robots as a service for the delivery of Dishcraft.
Sure. You know, it was really interesting. We initially thought we would develop the robot and install it directly into dish rooms. And then we found that it was a really high hurdle for an operation to have a big capital expense, and that we could solve their problem in a really frictionless way by simply doing the delivery, because there's no upfront cost for them. There's no risk for them to try it. And in fact, we give a free couple of week trial, and we have found that, you know, once you start with Dishcraft, you immediately convert because the service is solves all their labor problems. It also is more sustainable. And in today's environment, it's very, very sanitary.
So they have no upfront costs, you were saying. Do you provide them upfront with the dishes that they need? Because that is one of the I guess, secrets for how Dishcraft works.
Correct. We give them carts full of clean dishes. They are our dishes that are proprietary. The way our robots work is using magnetics, and so it requires using our specialized wares. And so we just bring in carts full of clean dishes, and we give them a collection system where they can drop off. It's very organized. It's ADA compliant. It's pretty safe, space saving compared to where people normally store their dishes. So it's worked really well for us. And that means for a customer, there's no construction costs, there's no months of planning. You know, it's been pretty delightful for both us and them.
That's great. So it really is frictionless. There's no extra labor, no extra routines or anything that has to be added to the workload in the restaurant before they can use the service.
Correct. Well, we service cafeterias, large volume ones, whether it's think of a hotel or a corporate cafeteria or a hospital. So we're not actually yet, although we have aspirations eventually to be in restaurants. So for them, they're actually reducing their labor right now. Even for an example, the janitors have said to us, "Hey, during a busy lunch rush, we're now looking for things to do because we're no longer having to track the waste out to, the waste bins if they were using compostables before they switched to our reusable ware."
Well, that's great. But did you find there was a big impact with the stay at home? If your primary customers are cafeterias, large, I guess, food service areas?
Oh, so we service essential businesses, and we have recently started to offer our services to help in this time of need to hospitals. And so we're finding that we are just as busy as we were before.
And was it the thought about providing sanitary dishes or sanitary food services to the hospitals that spurred you to do this? Or was it really just an extension of what your business plan is going to be?
Well, we were doing this previously, and we were working, for example, with financial institutions and other cafeterias that were not in healthcare. We did have one, we had a couple of healthcare clients that were about to start with us regardless. So this was an extension of what we were doing. But what we thought was really magical about this is we looked at the current situation in current dish rooms, and they're very small and cramped spaces. And we realized that the workers in them were unlikely to be able to be socially distanced. And so this was a great opportunity for them to use robots and use our service and keep their existing staff very safe.
That has been a big worry for me. I don't leave the house. I comply with the stay at home, except for going to the grocery store. And then, to my mind, everybody who's helping me stay at home by selling me food is placing themselves at risk. And clearly, it's only worse for people in a hospital area where there's going to be more sick people and very, very little time to deal with the daily sorts of chores, as it were. Even if dishes isn't your daily chore, just having this removed from the roster of tasks is going to free up people. Have you had feedback like that?
Correct. The other thing that we're finding is, so today, the hospitals are overloaded. And so some have twice the volume of what they normally expect a dish room to have to process. And so this can alleviate also that strain. So on many, many fronts, this has been, great for us to learn that we can be helpful.
That's wonderful. Thank you very much, Linda. Now, please chime in as we get questions, or if there's something in the discussion you want to jump on. But what I want to do now is introduce Vipin Jain, who's the CEO and founder of Blendid. And you can see we've got a little bit of a food theme here. So Vipin, can you tell us a little bit about Blendid?
Sure. So first of all, thank you very much to Silicon Valley Robotics for giving me the opportunity this evening. And secondly, I appreciate everybody joining us and carving out precious time in the evening for this event. So I'm Vipin Jain. I'm the co-founder and CEO of Blendid. And Blendid is a food robotics company. We use robotics and AI to automate food preparation and delivery for on-the-go food. Think about fast food, fast casual, that is automated using robotics and AI. We have been around for 5 years, and we spent the first 4 years of our life on intense R&D around robotics and AI and field trials before we were ready with our first commercial product that we launched about a year ago. And as they say, if a picture is worth 1,000 words, a video is worth 1,000,000. So why don't we watch a quick video to see what this first product is.
Meet Blendid, a contactless, automated solution for healthy on-the-go eating that's ordered from the safety of your cell phone and prepared by a robot with zero human interaction. Let's try one. Sarah here selects an antioxidant-rich, immunity-boosting blend and customizes it based on her unique taste and health preferences. It notes Sarah's custom blend and begins gathering the ingredients, whole fruits, vegetables, seeds, powders, and juices that are fully protected through the Blendid supply chain. Doing all this while multitasking Dan's, Ben's, and Ava's custom orders. Then it's blended, ready to pour, and served to you. Anywhere, anytime. And now, Blendid's AI engine knows the individual preferences of Sarah and all Blendid consumers, so that each blend is crafted specifically for them, with no risk of viruses or contamination. Always healthy, safe, and reliable. Real food, artificial intelligence. To learn more, visit blendid.com.
Would you like to tell us a little bit more about how things have gone since the rollout?
Yes, so we launched our first product at the end of March last year, so almost a year ago. And the first location we launched was the cafeteria of University of San Francisco in the city, Market Cafe. And we have been in operation for a year in the cafeteria. And we launched a second location in November of last year at Sonoma State University. And all I can say is, I think this is one of those cases where we have been just exhilarated with how the product has been received. When we started the company 5 years ago, we had doubts about the adoption, right? Because everybody, it was still early enough that people said, why do you want to automate food? It's too hard. And people won't like it. People don't want robots to make their food. And we said, the way the trends are and the way eating behaviors and lifestyles are, people have different tastes, and the standardized food doesn't cut it anymore. So you need a better solution using AI where I can get what I like to eat any time of the day, anywhere I am. And that can only be done using a lot of data and using robotics. And just to tell you a bit about my geekiness, I'm a Star Trek fan. I'm a Trekkie. And I have always been fascinated by replicator. So I always wanted to build a replicator. So I think this was one of those cases where I said, if I have to do something crazy, why not do something crazy? Automate food, build a replicator. And the reception at the campuses has been just amazing, and people love it. It is mobile experience, completely personalized, completely touchless, if you think that way. No shared screens if you wanted. And I think and we learned a ton. And we were just getting ready to start deploying in retail and corporate and hospital environment when the COVID hit. So I wish we were a little bit ahead, further ahead in terms of deployment, because as you can imagine, food is an essential service. We all want food. We all want access to food, but in this environment, we're really fearful about the safety of people working on food preparation and safety of us if you want to go and pick up food, because we don't know how the food was handled. And if you bring blended like product as part of essential service, in all these public places where people go, they have the confidence that they can interact with a fully autonomous robotic kiosk. From their phone, they can order what they want and they can get the delivery without interacting or fear of contamination. So yeah, I think.
So you mentioned hospitals. Have you deployed in hospitals? And
we have not yet. And this is where I wish we were further ahead. So we could have gone to hospitals and prepped them with a food option, which was safer and better than alternatives. Yeah.
It certainly would be wonderful, but really in a nutshell, you're speaking to the overall problem that I see with the rollout of robotics is everybody is very small. And there's a sudden surge of demand, but at the same time, the supply chain is broken, and the ability of small companies to scale it's a very, very difficult thing. What kind of impact has the current coronavirus shutdown had on your plans?
So if you think about the vertical where we started, and that was a college vertical, and we did 2 locations in colleges, they are shut down. Students are not on campus anymore. So we have paused both locations at the moment. for the safety of students and everybody else. As we move forward, as soon as the shelter in place is lifted and we are in a better place than right now, our plan is to start deploying in other verticals and along with college. So college will reopen in August in most places. And we'll start deploying in retail and companies and hospitals. So hopefully this time next year, we'll be in multiple types of locations where you need a better and safer and highly customizable food option that's available 24/7.
Yes, I think we're all very sensitive right now to how sterile or sanitary all of the processes that we have. And this is an ongoing tension in the food supply chain. We have a lot of interest from both farmers and people in the food services across the board saying, where are the robots? Why don't we have robots to help us with this? Because labor is a shortage. It might be cheap, but there's not that much of it around. And it's very, very difficult to solve all the little bottlenecks where you lose people in small operations. And the safety of the food products is critical. So when you see an example, like it takes 6 people to put different vegetables into a vegetable tray, that's 6 opportunities to contaminate the vegetable tray. So we're waiting for robots that can actually handle the food supply chain. I mean that quite literally, but that's definitely going to be a good topic for Ken to talk about. And I saw Ken was online as well. So we'll come back to that. Now what I'd like to do is introduce one of our guest speakers, Rich Stump, your CEO or principal at Studio Fathom. Rich, can you tell us more about that and how you've been impacted by the coronavirus problems?
Absolutely. Well, thanks for having me this evening. My name is Rich Stump. I'm one of the co-founders, and I guess my current title is Chief Commercial Officer of Fathom. Started the business 2008, so about 12 years ago, and it's around the technology of 3D printing, leveraging 3D printing for various applications. We recently sold the business last year to a private equity firm, and now are bringing two other companies together to form one bigger firm. And we're an advanced manufacturing company with a great deal of expertise around the technology of 3D printing and additive manufacturing. What we're good at is basically leveraging traditional manufacturing alongside with additive manufacturing to do things that were either previously impossible or to solve some interesting engineering challenges or product development challenges. So we deal with a lot of different technologies, a lot of different materials. We focus mostly on the enterprise. So our customers tend to be folks like on this call that are developing products, and we either help them develop prototypes to develop those products faster or leverage downstream manufacturing applications to solve some interesting challenges. So as far as it relates to COVID, it's been a interesting 4 or 5 weeks, especially in the manufacturing market. And obviously we saw a tail off in customer orders given everything that's happened with the pandemic. But what we've been able to do is really shift some of our focus to help the country, and then look for certain applications to obviously keep the business going during a time like this. And there's 3 main initiatives that we have going right now with COVID-19, and some of them are potentially revenue generating, but most of them are, just trying to help with our expertise and capabilities. And the first is obviously with the PPE challenges we have, and we have a facility in Asia and southern China, and so we have a vast amount of supply chain resources. So we called in our colleagues over there, and we found a number of factories that had FDA-approved PPE supplies that were overrun from the flattening of the curve in Asia. So, the news has been talking about investment into 3M and Honeywell and some of these large companies to ramp up production in the U.S., which is absolutely great. The problem is it's just not going to get done in time. right? Anytime you buy 150 thermoforming machines and you try to ramp up production to make N95 masks, it's going to take, certainly weeks, potentially months to get any volume. So what we were trying to do is match hospitals and senior homes and folks that needed PPE with supply chain resources that we had in Asia, vetted supply chain resources to connect. And there's been a number of challenges. It changes every hour, that whole supply chain. And we've hit a bunch of roadblocks to the point where we've tried to reach out to state and government officials to try to move some of the roadblocks with customs and tariffs and, freight constraints. And so that's been an interesting challenge, but we've been able to connect, I think, over like 1.5 million and counting supplies into the US from Asia. Obviously, it's not our everyday business, but we have resources, so we tried to help there. The second initiative was really around the test kits. And obviously, there's been a kind of shortage in the test kits. And it turns out, interesting enough, one of the big shortage items is the swab, the MP swab that goes back into your nasal cavity. And there's the main manufacturer of that swab was out of Italy. And obviously, with everything happening in Italy, that shut down a lot of the supply. And so we were trying to leverage with the folks, it was coming out of Harvard mostly, but there's been a community of about 50 folks that have come out of the 3D printing community and other manufacturing resources to see if we can 3D print these swabs. And actually, we've made a lot of progress. There's been, I think, 4 manufacturers approved to 3D print nasopharyngeal swabs. And we're hoping that some are manufacturing now. We're hoping next week we'll get into production of these in the, at least hundreds of thousands, millions to support the short-term need. Obviously, long-term, it probably doesn't make sense to 3D print them given the cost base, but with the current demands, we're looking at doing that. And there's some interesting challenges with using the technology of 3D printing that we can design swabs that could potentially perform better than the traditional swab. So that's been a fun and challenging project at the same time. And the third initiative is around the ventilators. And I think we were talking before the call started is, what's the activity in the marketplace or in the Bay Area, especially with ventilators. And, you have folks like Lawrence Livermore jumping in under the direction of the DOE to develop a ventilator with spare parts that are available today. And you have JPL, the NASA team, trying to develop their own ventilator. And then you have obviously the large automotive manufacturers who have partnered up with, various existing ventilator manufacturers and trying to ramp up production in that. So I think to date, we've got over 270 people have come to us with either a ventilator design, a mask design, or some type of shield design over the last, I'd say, 10 days. So there's just a tremendous amount of activity, and it's great because everyone wants to help, but at the same time, it presents a lot of challenges because there's so much effort going in so many different directions that you worry that, all these efforts won't end up being impactful by the time we need the supplies. So that was I guess a long-winded answer to your question, but.
Well, it's a very good answer to several questions in there. And I'll kind of work backwards. It seems like everybody wants the glory jobs, the redesigning the critical care equipment, and not that many people want to do things like cut up bolts of fabric into smaller pieces to go to somebody else to sew a mask, for example. That was just one of the jobs that came up this weekend. I, like you, am on a number of the communities that are trying to coordinate the logistics of the supply and demand for this crisis. And there are far too many people designing things. I think within all these groups, it's kind of quite clear the time for designing has passed. Yeah. And we've seen how also the time for hand doing things for some things has passed, because as things have moved further up the chain, larger manufacturers are starting to come in. And that kind of brings me back to the question that when you talk about the new design for the nasopharyngeal swabs, part of what we're seeing is people just moving to solve the critical problem right now or for the next week or two, and then that's it. You're not going to be doing that again. but it sounds like you might have hit a sweet spot where it looks like there would be an ongoing use for this.
Yeah, that's a great question, and something that we've, if you put a lot of effort into something, is it just to solve this problem over the next few months, or is there a need for what you're redesigning or what you're developing for other markets or other applications? In the swabs case, obviously, it's used for this test, but it's also used for flu and other types of tests. And I think it's opened the community, the Thermo Fishers, the J&Js, the BDs, the large medical companies that need swabs. It's opened their eyes that you could potentially use other technologies to produce these. Like I said earlier, 3D printing in our business, 3D printing has evolved over the last 20 years, certainly over the last 5 years for more manufacturing applications as the materials have gotten better and the processes have gotten more mature, and the cost of the materials has come down. So what we see is kind of a sweet spot today is using 3D printing as a kind of a bridge to production. So if you're using it for prototyping and then you need thousands of something or tens of thousands of something, it makes sense to not use traditional tooling to ramp up it in production and stay extremely agile with the use of 3D printing if it works for your manufacturing application. In this case, it's a perfect example where the swab is printed and we can print it. I think it's like 50 cents is our cost, or with labor and everything, to print one of these swabs, and normally it's probably 10 cents to make one out of these guys in Italy. So it makes sense short term, but long term it makes sense to tool up, injection mold these, and you can mold them for 5 cents, and you can use the design that we design now for 3D printing with some changes to injection mold it. So yeah, we think that the current design that we have, that we've been testing at Stanford, and the folks at Lawrence Livermore have been so gracious to do some mechanical testing for us, is actually conducting the test better, is kind of getting the necessary test specimen better from the cavity than the traditional swab. So
excellent. It's a wonderful opportunity for new processes, new designs, and new collaborations, new collaborations as well, where organizations are stepping into roles that are suddenly needed. And one of those is the validation of supplies. Are they safe? Two of the changes that I've noticed this week is that the FDA has, the FDA or the NIH has set up as a repository of 3D print designs to say these are, although I found that they didn't seem to prioritize the ones that had been validated in clinical settings. But if you look for that, that is there. Now, Mark, are you there? I would love to learn a little bit more about this transition up the chain to the larger manufacturers. And Mark Martin is the Regional Director of Industry Workforce Development for California Community Colleges, and also started the Bay Area Manufacturing Discussion Forum. So he's been very central in a lot of these efforts.
Thanks, Andra. Yeah, so my role is within the community colleges, and my background's in manufacturing, but now I have a role in workforce development where I work with the community colleges and K through 12 to get them connected with industry and on career pathways in mainly the skilled trades, because that's where the community colleges are focused on 2-year degrees in machining, welding, electronics. But part of that role is is to be very connected with manufacturers in the region to figure out what they want as far as, skilled trades employees, what their needs are, and to help make them the connections with the community colleges. So I have some insights into, the manufacturers and what's going on with them. So when the crisis hit, one of the questions is, how can we, is there a possibility to repurpose? Is there a possibility that do some of these companies actually need more workers? I've actually seen companies reaching out to me saying that they need maybe some food manufacturers, but more maybe medical supply, or others that are supplying parts to critical businesses. So I've actually seen a little bit of that. So of course there's much more of the manufacturing companies that are being hurt and having to furlough people. And I also reached out and said, which of you, of the 8,000 in the Bay Area can kind of repurpose? And I think Rich talked to this, kind of pretty succinctly is, in some things it's relatively easy. Maybe you're an injection molder and you can injection mold these face shields or some of these parts of the face shield. You have to get the molding in, but that's still within your core business. Others are, maybe contract manufacturers that could theoretically assemble, ventilators, because they're already doing medical products, and a ventilator's, a complicated product, but not necessarily more complicated than some of these people are already doing. And then there's others that are like, well, you're doing something in fabrics, you're doing something with some sort of molding, but you've never done masks. So how do you do that? As Rich pointed out, well, you might have to get specialized machines, or maybe just specialized molds. How long does that take? But then you have to start having this expertise around, what materials what's GMP look like if you haven't done medical products before? How do you handle the equipment and ensure QC? And then there's a whole FDA of they approve factories. They approve designs as well, but a lot of times they're approving the factories to be able to produce these. So how do you get around that issues? And so it takes a lot of time to get up and going on that. So, I created a list and I got about 170 responses, close to 200 responses of the Bay Area manufacturers saying there are things that they think they can do. And I've supplied that list to the state government, to be honestly, for what that's worth. There's, trying to get to them and connect is sometimes difficult. Going on right now, but then you start to look at what's happening overseas. Rich and others have a lot more insights into that, having supply chain over there, but I've talked with others that theoretically that's coming down the pipe. And is it going to be here in 2 weeks, 3 weeks, a month? So that that's something to consider as well. And I think manufacturers are thinking about as far as trying to repurpose.
That poses a problem if in maybe more like 3, 4, 5, or 6 weeks time, are we going to end up with too many of some critical components or supplies?
And to give you an example, I actually kind of a little bit on the side of what I'm doing, but not totally, because the community colleges have maker spaces and fab labs. And so where I sit at Laney College in Oakland, they have a fab lab. And so we started working on face shields a week and a half ago, because that was relatively simple for us to be able to do. And so we started working on that and created some of the kind of the foam ones with the plastic shield and the elastic band. And so we got that going. And, my thing was, well, if you're going to do this, and people were 3D printing, let's injection mold. So we're actually took us a design that was done by Stratasys and modified it a little bit. And in like 2 days, we got a molder to say, let's injection mold it. Well, they're making their injection mold. It's going to be a couple of weeks. And honestly, I have no idea if they were going to need it in a couple of weeks, because I have no idea what the demand is. I don't know if Apple's bringing over 1 million a week, they say. Others are doing this, 500, 1,000, 10,000 at a time, kind of in, basements and little shops.
Yes.
But I don't know if the demand is, 5 million a week, or 50 million. Just to give you an example, we delivered our 500 shields to Highland Hospital. It took us a day to do it. 6 people. I asked them what their daily use was for face shields, and they said 600 a day. So I was like, all right, that was a day's worth for this one hospital. And so that's the thing that the manufacturers are all trying to figure out. And unfortunately, whether or not you believe in big government or not, having, I kept wondering why the government didn't take a little bit of, not control the supply chain, but just even monetary financial incentives to say, we will backstop you if you can do this. If the demand falls out, we'll, make sure you don't lose money.
Yes, I think we just lost you a little bit there, Mark. If you can just repeat.
So one thing to follow up on Mark's comment was
might lose a lot of money on the other end.
He's back. Mark, can you hear us?
Did I drop out there?
You dropped out a little bit. Yeah, I was going to pick up.
Go ahead. Yeah, please do.
I was just going to say one of the things to touch on that is the other thing is it's turned in with the PPE, it's turned into the wild, wild west and the gold rush where you have all these people. I'm on a WhatsApp group with like 300 people. It's doctors who need supplies along with people that can provide supplies. And now you have people coming in thinking they can make money on this. And so they're just completely, in a situation where I think a lot of people were trying to help. Now it's a lot of people see this as ways to make money, and it's just, it's completely making it a mess. So that's the other factor is like now you have so many people coming in to help, and some people, their intentions are good, and some people, their intentions aren't so good. So
it's such a shame. Back to the point about, potential oversupply and just not having insight into where the supply chain is going. I know N95s remain in really high demand, but a company was approved today to sanitize them. And you can ship the N95s to them, they barcode them so that your hospital gets back your masks. And in a one-day turnaround, they can sanitize them good for at least 20 pass-throughs for an N95 mask. So we might see more solutions like that coming online. Now, I'd like to ask one of our regular guest experts, Ken Goldberg, to share his insights into what's happening with robots and COVID.
Okay, thank you. I appreciate what the points that have been made. I think it's actually a really good point to raise that there's been so much volunteer effort, but it's such a moving target right now, and it is indeed very tricky to find out where we can be most helpful. I know there's literally 5 or 10 different lists and resources that I'm trying to track too. That WhatsApp that Rich mentioned is just a fire hose of information, and it's really, I think everybody's kind of scrambling right now. So I want to yield my time, but I will I'll mention really quickly the issue of food that you mentioned earlier. We have been doing some thinking about farming and small local farms in this context. I don't think this is going to be ready in any time for this crisis. As Andra, we've talked about in the past, that we have to start thinking ahead to the next one as well. And if there's anything we can do now, certainly we'll be alert to that. But I also think it's important to think, okay, this is not going to be the last time we're going to face challenges like this. And the project that we've been working on is this. It's an art project as well as a science or proof of concept project. And what we're trying to do is understand if we can get models for polyculture farming. And this is where we have, let's say, backdoor gardens where you have lots of different kinds of species growing together. So if it's okay, can I share my screen and I can just show you?
Yeah, that'd be fantastic.
Okay. So,
we get to see Alpha Garden.
Yeah, I think I can play it. Let me just see if let's see.
Yes.
Do you see it playing there?
Yes, we do.
Great. Okay. So I'll just tell you, to walk you through it. This is just a couple minutes of a clip, but this is the robot. This is a farm bot, which you can buy from a company that's local. Actually, it's in on the West Coast, San Luis Obispo. FarmBot sells these for about $3,000. What we've been doing is setting up a system with a camera and taking a time lapse, which you're seeing here. This is over a 3-month period from January 1st until now. And every night we take another image of the garden as it's evolving. And this includes 14 species of edible herbs and plants. So they're all growing in close proximity, as you can see here. And the challenge is that they're competing for a increasingly scarce light and water. So you can see what happens, which is that this starts to really get quite out of control. And the garden is, at this stage, essentially actually been operating autonomously because we haven't been able to get into the greenhouse. So it's starting to decay and it's starting to break down that. And certain, invasive species essentially have taken over, like mint and certain, actually, this is what you're seeing right here is the ability to zoom in, and it models the species of each plant based on the early seedlings and their locations. And then the idea is it tries to use that to estimate the diversity of the garden. So we're trying to optimize diversity, that is to maximize the number of different plant types that are growing. So that means to cut back on the invasive species so that they won't dominate. And let me just see if I can. The key idea here is that we can simulate the garden, because it takes too long to, every cycle takes literally 3 months. So we have a simulator that can simulate at 10,000 times the speed of nature. And what that's doing here is simulating, this is here 64 gardens, but we actually simulate thousands of gardens with different parameters to fine-tune parameters for the system. So this is the red squares are where there's pruning occurring. And then we evaluate each of those gardens to figure out how to tune the parameters. And then at the end, we actually we have a pruning device and then watering devices, as you see here, to control the garden. So we're going to be, this is an ongoing project that we call Alpha Garden, as you mentioned. And the hope is that over time we can learn a policy that will be able to actually work in gardens and allow them to be automated, because it's actually quite time consuming to do this manually. That polyculture is much more labor intensive than monoculture. So if you wanted a backyard garden, it's, as most people know, it's a lot of work to keep it under control. So the idea is, can we do this autonomously? And the reason it's an art project is because it's actually extremely difficult. It's a big challenge. So I'm not at all convinced we're actually going to succeed. It's really putting AI to the test. And so we actually just this week did a deep learning method based on the data that we collected from our simulator. And we're just at the very early stage of seeing how that works in simulation. And then eventually we'll take that into the next generation of the physical garden.
Wonderful. And I'm a huge fan of FarmBot as well. I was hoping to have a FarmBot myself, but it makes me think the perfect thing from my perspective will be bringing together what you're able to do, which is still right at the front line, with what Blendid's able to do, and eventually to have my own personal cuisine, as it were, food that is grown custom to my preferences and recipes and tastes, and then prepared that way. I think that's perhaps more than my lifetime away, though.
Well, maybe not, but it's actually an interesting idea. Like in a time like this, could you actually grow a self-sustaining food supply in your backyard? I mean, that's not going to be for everybody, but some people will have enough, land area that they could at least supplement their food supply that way.
And that solves many problems, more sustainability, less transport, and reduction in those carbon costs. We are seeing, this is perhaps one of the biggest examples of bringing manufacturing back to local just in time, I think, that anybody could have come up with. And some of the things that we're talking about is what's keeping robots out of the food industry at the moment. And I think it's the inability to manipulate dynamic and delicate objects.
Definitely.
So I can share some light on that. I think what has kept robots out is typically the food service business is not very forward thinking. I think they are laggard, if you will, and it takes time for them to get comfortable with automation in their environment that they operate. So for example, we actually work with all the major food service operators, so Compass, Aramark, Sodexos of the world, and we have seen it consistently that they want something which is tried and tested. That is, yes, you can have the latest innovation, you can have the latest robotics product, but it has to perform in the field. It has to do the job well. And they want enough proof points of that happening before they will adopt it. So we offer So for example, with Blendid, we offer two options for our customers. One is where it's a franchise model. So we can come and operate food service for you using Blendid. So we can bring this kiosk, we can bring this food service option in your environment, and we can operate. Or once you get comfortable, you can take over and start operating it. So right now we are in that phase where they want to see enough of the proof points, enough excitement around it, enough of the unit economics that they say this is something we can rally behind and we can adopt broadly. And we are starting to see that tide turn, but it takes time to get to the point where you have field tested product that can really automate food prep. So operators are comfortable.
In fact, one of the questions from the audience was, what is the return on investment for a company in having Blendid?
That's a great question. And this is, it's all about unit economics. When it comes to food service, it's all about unit economics. And what we are seeing is with Blendid right now, you can get 12 to 15 month cash and cash return.
Okay, that's
recent. And that is crazy in food service, because if you think about any kind of capital investment you make in food service, it is at least 5 years, 5 to 7 year cash and cash return. Blendid can offer less than 18-month return in most environments. And of course, higher the demand or more the foot traffic, better the economics, right? Because it's the variable cost is very low. So it's a fixed cost that you want to amortize. So higher the demand, the better. So that is what we are seeing. And USF is just crazy. I mean, for us, it has been an insane environment. And Blendid is always busy. It's multitasking. It's making 9 orders simultaneously, and it's just busy all day long. Students come throughout the day, and they enjoy blends. So yeah.
That's why it's so good to have you and Linda on, because you are showing that it is possible to get robotics into businesses that are very, very slow to adopt, very, very price sensitive. And, you know, I see this as a very hopeful kind of sign. In fact, Linda, there was a question for you. Hadn't anybody tried dishwashing as a service before?
Oh, so we found someone who was doing it. We found 3 instances of someone who was doing it. It started in Singapore and Hong Kong, where they had centralized dishwashing hubs as a service where they would service restaurants, only powered by humans though. And so we're the first that we know of that are powering it with robots.
Excellent. And another question, probably for you, Vipin. How do you stop customers from contaminating the kiosk, given that we're focusing a lot on sterilization and sanitization?
Yeah, so this is, again, this goes back to when you have the whole interaction between the robot and the consumer with no shared screens, I think it automatically brings a level of safety and comfort. Now, there are 2 major touch points that you think about in food service. One is when you have to restock, because you have to make food, you need to restock, right? So whether it is once a day or twice a day, you restock. So that's a human operation. And typically in food service, then you have the line cooks, or you have the servers, you have people who are making food and delivering food. So with Blendid, what we have done is we have automated food prep and delivery experience. You still have to restock once a day. So you open the kiosk in the morning, you have to fill all the ingredients. But that's a very controlled environment. That's a very controlled step. But you can take all the measures that you want to take to make sure it is done in a very tight environment, very controlled environment by the operator or by Blendid staff, right? So we load the kiosk. After that, there is no human intervention required. So you place the order using a mobile phone, and you can customize any recipe to your taste and allergies. Robot will make it, and robot will keep it until you are ready to receive it. And when you're ready, you have the QR code on your mobile app, and you identify yourself to the kiosk, and robot will deliver it to you. There is no human shared screens or shared spaces that you need to worry about. So, and obviously robots don't catch bugs. So I think
the actual handover point, you know, where people reach their hands in, that would probably be the most risky area. Is that something that you monitor? How can you make sure that it's clean?
That is a great question. So there are 2 aspects to it. One is what is the delivery experience? And that is it completely automated where your order comes out through a window and that window can only be accessed when you're ready to receive your order, right? So it's so we have the delivery window, which is closed, and it opens when the order is delivered to you, once you are identified as a customer who is here to receive it. So that's the delivery window that will open when you are ready to receive it. Now, you as a consumer can still touch different points in the window while you're picking up your cup, in this case. And for that, we rely on machine vision. So we have 9 cameras inside the kiosk, and we use machine vision. And for a lot of things, we use machine vision for level detection for all the ingredients for restocking. So for example, we use machine vision to detect if the cup is placed in the right spot, because sometimes you can have exceptions and you want to eliminate exceptions for a fully autonomous system. We also use vision to detect if customer has picked the cup where it was delivered or not, right? So as long as you as a consumer are only interacting with your cup, you are safe as a consumer. Even if somebody else has touched the other parts of the kiosk while interfacing with their order. So, but we use machine vision to also identify what has happened, and if needed, you can take additional measures on top of that. Yeah.
Oh, thank you. A question for Ken now. Is the work that you're doing on manipulation and grasping dealing with the issue of delicate, soft foodstuffs?
No, that's actually a great question. It's very, very difficult because of that deformation. So we assume that objects are rigid and that they're not deformable. One really interesting area of research is trying to deal with deformable objects like fruits, vegetables, and so anything that could be bruised is absolutely another category. And by the way, there's a number of medical applications there too. For example, hoses or cables, any of that is a deformable one-dimensional object. And the deformable two-dimensional objects include things like fabric and cloth. So if you want to sew or do anything with materials for masks, that requires understanding and handling deformations. And that whole entire area is very much in its infancy, I would say. There's a number of researchers looking at it, but it's a challenge because it's very hard to model and anticipate those deformations, especially for something like fruit and produce, where every strawberry is essentially different.
Different and deformable, which makes them non-sellable. Yes, so we've got a long way to go there. One of the next questions is, aren't industry leaders like McDonald's and Starbucks already doing robots? If not, why not?
Yes, I can take that. So I know that both the names you mentioned are looking at robotics. Obviously, they have not launched anything, and it is a complex problem. If you think about food automation, not just from hardware or robotics perspective, but also software perspective, and you have to build a really complete system to automate the whole process. You can automate a step in the process, that's easier. But if you want to automate a multi-step food prep process, that becomes fairly complex between robotics and IoT and control systems and orchestration and resilience that you need to build. So I think, again, going back to food service and food operators, I think some are more technologically advanced, some are not. And I think it will just take time. If they want to do everything in-house, it will take time for them to build a system that can work in a field environment. Just to give you a sense, I mean, when we launched Blendid, and I'm sure most of you can appreciate, we were operating our autonomous kiosk at 90% uptime when we started about a year ago. And from that 90% uptime, which is not anywhere close to being good in a commercial environment, we were operating Blendid at 99.2% uptime last month.
Very good.
So that's the level of improvement and learning that you have to feed in to deal with, to identify all those exceptions that you have to overcome, you have to eliminate from the system. build the resilience, build robustness in the system, because it is working at very high throughput, and it has to work that way all day. So
actually, on this topic, in fact, we just had the Human Robot Interaction Conference. It's online at the moment, and I did an industry talk session on Friday with guest speakers from ARM and from Cambridge Consultants and a couple of other companies. But I particularly find the presentation, and it's a video online if you search for HRI 2020, with Chris Roberts from Cambridge Consultants. He described a project with the food service industry to look at using robotics and AI, and what he wanted was the robot dipping chips and doing burgers and all the rest. But on evaluating that, that was not the direction that they went. And this is something I've heard from a number of other people who've been doing robots for the actual preparation of food itself. And we saw, for example, Creator, who make those fantastic hamburgers, they didn't have a robot arm doing it the way humans do it. They completely re-architected the entire process of constructing a burger so that it could be done mechanically. And this was coming to a question I was going to put to Rich and to Mark about the materials that are being used for robots and what qualities, what processes and what qualities. One of the things that comes up is that 3D printing is really not ideal for a lot of these medical purposes because of the porosity and so forth. Are we limited to the materials and to the processes when we're doing food grade robots and work?
So I think I'll start and Mark can continue, but one of the things that has been developing most rapidly on the side of 3D printing or additive manufacturing is materials. Like materials are really, the machines can only do so much. The materials is really where a lot of the value lies. We deal with mostly, we don't deal with food printing. Most of our printing processes are polymers and metals and plastics and different types of, rigid materials and flexible materials. But I would say in the world of food safety, there's certainly a number of materials out there today that you can print in that can handle some type of food applications. You mentioned porosity. I think when people think about 3D printing, porosity is definitely a negative. Depending on your application, it could be a positive. But we approach porosity. Well, there's some material, there's some processes that aren't as porous as others. But there's certainly some technologies that you can use, which we call post-process technologies, to basically make the parts non-porous. And so there's different vapor processes and different types of machines that are coming out that you can dip the parts in various types of materials to take away the porosity. And I think when I think about robotics and the topic today as it relates to 3D printing, one thing I'm really excited about is how can we use robotics more broadly in the additive world to produce products for production. And the biggest challenge we have, especially in our business, is we produce so many different types of geometries and so many different products. It becomes hard to program robots to do so many different things when they're handling so many different types of objects. And so, obviously we have technologies to help with that. But I think in the additive world, it's been a big challenge for us because once you print these parts, then you have to go through these post-processing methods to end up with your end-use part. And so that's where I think robotics can play a huge role. But it hasn't really developed much yet. But as far as materials, I think in the next 5 years, we'll start to see some amazing materials. I mean, the folks at Carbon down in Redwood City, the carbon printers, their materials are really good for certain applications. They're actually printing a swab too, and one of their proprietary materials, which is performing really well. So materials are developing, and there's going to be a ton of applications over the coming years. As it relates to food, I think you'll start to see more food grade materials come from the printers.
Oh, that's great. Now, I'm seeing a lot of questions coming up in the chat, and what's wonderful is I see, Vipin, you've dived in and you're answering some because you're certainly getting a lot of questions. And now the debate has actually shifted into the broader topics of data and privacy, which I think we could do an entire call just about that. What I'd like to do now is just a wrap up of what's happening locally, what can be done, how people can get involved, and where to go to find all that information. Because I think when you go looking, you probably feel like Ken was saying, that it's a fire hose of information out there, and it's pretty hard to find the right information that you need when you need it. And I have to say, it's not just our fault as recipients of data fire hosing. For example, the federal government sent round a request for, did you need funding to produce stuff? And it arrived at the Association of Manufacturing Technology, I believe, at about 10 a.m. this morning with a deadline of 1 p.m. And I think people were sharing that out really quickly. But if anybody else got that with more than a 3-hour window between receiving it and the deadline, let me know, because you have much better sources of information. So first off, where is the best place that you find to go for information about what's happening and how to get involved? I'll just ask each of you to tell me something about what your source is.
Well, actually, I think that the thing I think Rich mentioned, the WhatsApp list is very helpful. There's a number of lists I can send you, Andra. I think it is right now. It's very scattered, and I don't know of a single really best source, unfortunately.
Yes, well, we kicked off this series with people who were involved in helpful engineering and open source COVID medical supplies groups. They're both very large, very active, and producing great things. We'll get people representing those groups on the next call. Also, some of the more local groups, like mask making groups, there's a whole range of them. And just sometimes it's so much activity, but there's a really good role for local groups making masks, because you are delivering them to places in your local area. It's not a really large scale project. It's something that is quite local. And I believe that Keay was saying we only need 327 million masks. Go. And that was the cloth masks, not the N95s. So helpful engineering and open source COVID medical supplies are good groups. And if you send me that list, I will disseminate it to everybody today on the recording. And so put lists in the chat if you've got suggestions.
Hey, Andra, it's Mark here. I want to say something. There was a question about automation and about whether or not over the next few months, with the COVID crisis, there will be a kind of increased discussion about automation. And this is actually where my expertise matches with the kind of the automation, because I'm not a robotics expert, but I'm a workforce expert. And I can tell you that, manufacturers in the Bay Area, with the costs that are, there for labor, have done a pretty, extensive job of trying to figure out over the years what automation can be, brought into their factory that makes sense. And, some companies are better than others, but, companies have looked at it. And of course, as technology improves, it's, slow, but it is improving, then they'll start to look at it and see if it makes sense. But now we have an instance of there's a new factor that's involved that could kind of be a step change. I'm not saying it will be, but now you're starting to deal with, well, do we have to kind of think about safe distances, for the foreseeable future? It's just that, maybe it's not 6 feet, but maybe you don't want people, handing it back and forth to each other. What are the safety issues with that? What about the safety issues with just handling products that are then going out to customers? So there might be another extra factor that people before says, well, the technology is just not cheap enough. It's just not fast enough for me now. But now there's this extra possible layer of cost that you have to consider, which could make a difference for a number of companies. It'll be interesting to see what happens.
Absolutely, especially if robotics can match with a degree of adaptability and flexibility in what's coming out on market. That is certainly what I'm seeing develop in the robotics industry, and yet it's not widely adopted yet. I think you raise a great point. People are now going to look at robotics with a different set of costs and values in their mind. So thank you very much, Mark. In fact, thank you, Vipin, thank you, Linda, thank you, Rich. It's been a fabulous discussion. If you've got parting comments that you would like to leave, I know we've already gone past 8 o'clock. So I'll just ask if you've got a parting note, and then we'll wrap it up.
Thank you for doing this. Andra, you're terrific.
Thank you. It's a pleasure to have you on the call, all of you, because I learn so much every time we have this discussion, and I get pretty excited about what the opportunities are going to be for the robotics industry as well.